So good afternoon, and thank you for joining us for our Career Connections webinar today. My name is Brent Giangregorio, and I'll be your host today. We're very excited to kick off our 2022 Career Connections webinar series with Sarasota Memorial Health. But before we get started, just a few housekeeping items. Today's session is being recorded, and it will be available on our YouTube channel within 48 hours. As well, because this is a webinar, all the lines are going to be muted, but we do really want to hear from you. So if you do have questions, at the bottom of your screen, there's a thing that says Q&A box. You can go ahead and click on that. You can type your questions in that box as we move through the presentation, and we'll leave about 10 minutes at the end of the presentation for question and answer. Okay, let me see. 1 second here. Okay, wonderful. Okay, so our speakers for today are Corey and Sherilyn, both human resource consultants with Sarasota Memorial. Corey is representing the Venice campus and Sherilyn the main campus. As well, we're going to hear from some employees, Belinda and Montserrat, both multi-skilled technicians. And then followed by the Q&A. And after the Q&A, if everyone can stay on for 1 extra minute for a survey that will pop up on your screen, we would really appreciate it. Your feedback is really important as we use these surveys to kind of help us with future webinars and programming. So before I turn it over to our presenters, I just want to take a few minutes to tell you about the Women's Resource Center. So the Women's Resource Center has been empowering women in Sarasota and Manatee counties since 1979. We have 3 centers across both counties, one in Bradenton, one in Sarasota, and another in Venice. Our programs and services are delivered remotely via Zoom for now, but when we open our physical locations, clients will be able to have services in person or remotely. Currently, we serve over 1,700 clients a year and are delivering over 5,000 hours of programming. So really, our goal at the Women's Resource Center is to engage, educate, enrich, and empower women of all generations. And we're really a place where any woman can call when they're not sure where to turn to for help. Now, to do that, we offer our clients a variety of programs and services, including resource advising, mental health counseling, career services, educational workshops, scholarships. We have legal and financial consultations, as well as wellness programs. And all of our programs are offered at a low or no cost to our clients. Okay, well, since this is a webinar about careers, I'll talk a little bit more about our career services. Our career coaching program really offers individual assistance in preparing for a successful job search. So that can include career discovery, resume preparation, interviewing skills, networking techniques, and really much more. All of our locations also have a career center. They're currently closed, but when we do reopen our locations, our career centers are really where a place that clients can come and conduct online job searches, work on applications, update their resumes. In our career centers, they can also get one-on-one computer tutoring, and that can help them with navigating online job sites, uploading resume, basic computer functions, Microsoft Office applications as well. Additionally, we offer 2 career closets, one in Bradenton and one in Sarasota, where we have free clothing and accessories for women who are attending job interviews or have just secured a job and need work attire. The career closets, we also do serve clients that need clothing for any reason. It doesn't necessarily have to be related to career. And currently our career centers, our career closets, are open every Wednesday from 11 to 3. Okay, so like I said, if you'd like to ask a question during the presentation, at the bottom of your screen, there's a box that says QA. Go ahead and click in that. You can type questions and we'll get to them at the end. And again, we will have a replay of this webinar. It'll be on our YouTube channel, but we'll also send out an email with the link to that, as well as the presentations to everyone who registered for today's session. And the last thing, again, we want to hear from you. So as I mentioned earlier, when the webinar ends, you'll see a survey pop up on your screen. Again, it's very, very brief. We ask if you can please fill it out, and it really, really helps us. Okay, with that being said, I'm going to stop sharing my screen, and I'm going to go ahead and turn it over to Sarasota Memorial, and they'll take it from here.
Fred, do you see our screen now?
We do.
All right, wonderful. Hi. Hold on just a second. All right. Good afternoon, everybody. My name is Corey Tile, and I am a human resources consultant for Sarasota Memorial Hospital Venice campus.
And I'm Sherilyn Ballin. I'm also a human resources consultant here at our main campus in Sarasota.
And we thank you for the invitation to speak with you today. We'd love to share with you a little bit more about Sarasota Memorial Healthcare System and some careers that are available to you. One of the things that Sherilyn and I always notice as we're out at career fairs and schools is that people will often think when they see Sarasota Memorial that if they're not a doctor or a nurse, that they probably wouldn't be a good candidate for us. And that just couldn't be farther from the truth. We have so many opportunities here at Sarasota Memorial in every type of position. And we offer training, we offer tuition reimbursement for lots of different programs. We're going to tell you all about those today.
So when we talk about when you're looking at careers, what is it that you really love to do? What is it you're passionate about? What is it that you like to spend your time doing? What maybe subject in school interested you or that you excelled at? And then kind of look at what your skill sets are. What are you good at? What are you proficient in? What do you feel like is something that is going to be rewarding, but something that you're really good at doing? And then the other thing I always say is look at the job opportunities because that's going to change based on how the job market is and how our economy is and technology. One of the great things for us, though, at Sarasota Memorial is when you look at what the top job opportunities are, usually 8 out of the 10 top are going to be some type of medical related type of position. You also have IT, you also have finance, but we also hire for those departments as well. So looking at what are the job opportunities that are going to help you once you get your training to be able to get employed, and then how you're going to be able to advance in that career. We started in 1925, so we will hit our 100-year anniversary here in a couple of years. We had 10 employees and we had 32 beds. We are a nonprofit community hospital, so we service all of Sarasota County. So you're not going to find us in Tampa. You're not going to find us in Fort Myers. We're only in Sarasota County.
And so you see the growth that has happened over the last almost 100 years. Our main facility, Sarasota Memorial Campus on Tamiami Trail, is an 839-bed hospital. And we've just opened our Jellison Cancer Tower. It has 56 private suites and state-of-the-art oncology equipment to help serve our cancer patients. And in November of last year, we opened our Sarasota Memorial Venice campus. That's a 110-bed facility with quick expansion plans to 400. We have already started the groundwork on our new Northport Hospital, which will open in about 3 years on Sumter Road. And so we have a lot of people that are working with us now in Northport that have already said, oh, when you open that hospital, I want to be on the opening team. So that's something to think about. You could start at one of our other facilities and then maybe be closer to home if you're living farther south. We also have all of the first physician groups. So all of those doctors' offices that are first physicians groups are Sarasota Memorial Hospital doctors' offices. And we also have standalone urgent cares that you've probably seen throughout town. So we have grown from that 10 employees back in 1925 to we're almost at 8,000 employees now in 2022.
We are considered the largest employer. Sarasota County used to be the largest employer in the county, but we actually surpassed that. So as an organization, growth and opportunity is something that we're always focused on. And we're looking at what services that the community needs for us to provide. And we're always looking to provide those services. So you'll see other standalone businesses come open, offices other than our Northport Sumter Hospital, but there's always a lot of opportunity in the medical field. So we're going to just kind of go over some of our entry-level positions and things that you can kind of get your feet wet doing. We're trying to recruit the highest quality of employees. We do a background check on everyone. There's also a medical screening, and that includes a drug test. And we do require the flu vaccination, which we give. And then we also are mandated to have everybody have their COVID vaccinations. So those are some things that recently changed with legislation. But the hospital is probably, I always said during this whole pandemic that I feel the safest environment for me is right where I'm at. All the preparations that we do and all the cleaning that we do, it's really amazing what our facility is like. And I completely feel safer here than I ever feel going to the gas station, the grocery store, or anywhere else. So that part of it, I wouldn't be concerned about at all.
Okay, so environmental services is a great way to get your foot in the door at Sarasota Memorial Hospital. We have openings right now at both of our campuses for this role. There are environmental aides, which is basically a housekeeping type of role. You're cleaning patient rooms, cleaning nurses' stations, or an environmental technician, which is more of a floor tech. They're helping with the waxing and buffing of the floors. They also help with trash removal. So I always say if something happened with our environmental aides and they didn't come in for a day, the whole hospital would close down. It is basically their job is infection control. And so we've got to have them. They're critically important for our success. The starting pay rate in both of those roles is $16 an hour, and then more with experience. This position does not require a GED or a high school diploma. So we have a lot of people who are coming here from another country, and maybe they did have a high school diploma in the other country, but it didn't transfer for some reason, and they're still pursuing their GED. Those are folks that we would love to talk to and see if we can help to get their foot in the door in that area. We do always encourage our employees to get their high school diploma or GED, and we can help guide you in that direction, because as you're moving up through our career ladders, many of the positions do require that, but this particular position does not. We have all shifts, morning, noon, and night, part-time, full-time positions available in environmental services. Food and nutrition is also another big area that we need some help on. Anybody with strong customer service skills, this would be a great place for them. These positions all start at the $16 an hour range as well. We have dishwashing positions, assisting in the kitchen, cleaning the silverware and the plates. We have food service positions where you're prepping food, cutting fruit, getting grab and go fruits ready for the restaurants. There's a retail attendant position, which is customer service and cashier. Nutrition attendant position where you're actually going into patient rooms, taking their meal orders for the day, keying that into a computer, and then delivering their meals. It's very much like a server at a restaurant. And then a nutrition technician, where you're helping, that's a nice career ladder. You're helping with developing the prescribed foods based on the medical needs of the patients. So there's definitely a career ladder there. For the food service worker, dishwasher, and nutrition attendant, those positions do not require a high school diploma or a GED. The nutrition technician position does.
We have also patient transport positions. Sometimes those are the ones I hire for, and I get people that say, oh, I love to drive. So it's not driving your car. We're not transporting them on the road. We're transporting them within our internal facilities. So you're taking them from their bed to a procedure, to a test, wherever they need to go. And you're providing that customer service, letting them know what the process is going to be, helping them get there, making them feel at ease. And that job also starts at $16 an hour. Of course, one thing about healthcare is we are open 24 hours a day, 7 days a week. Not all of our positions require weekends, but a lot of them do. And especially if we're doing something directly with patient care, a lot of those positions will require rotating weekends if you're full-time. But then again, not all do. And we do have several different shifts to offer based on the needs of our employees. And that also doesn't require a GED or high school diploma.
Okay, central sterile processing. So this is the role where you're sterilizing all of the equipment that people will be using in surgery. It's a great foot in the door to a new career. So there's a progression ladder there, as you see, to instrument technician and then instrument specialist. And then we see a lot of people then going back to school to get their certified surgical technologist certification. That is a great field, and there's not enough people in it. So that's a great career path for you. You learn all of the sterilizing techniques, and it's a wonderful career path. For the sterile processing assistant, it does require a high school or a GED, but no experience is required on that one. They will train you on exactly how to do it. And then as you spend more time with them, they will help you with your certification. So you'll see that certification for a CSPDT or a CRCST. Those are things that you can do while you're here. We can help train you for that. And then you would go take your certification exam, and you can then have that career ladder as a result.
On the hands-on patient care side of our organization, the patient safety attendant is kind of an entry-level position. It does not require a high school diploma or GED. They are sitting with our patients, our at-risk patients, so patients that have dementia or that we're concerned about that might injure themselves further by being in the hospital, by trying to get up or trying to get something, doing something. They may be needing monitoring. So those people are in the rooms with them or are viewing their rooms from a monitor. We also have another side of our patient safety attendants, which also help our patients depart our facility. So as soon as someone is released, the clock is ticking, and at Sarasota Memorial, you'll always see a lot of statistics around everything that we do. So from the time that somebody comes to our facility to the time that somebody leaves our facility, we're timing those procedures. We're getting them in and out as fast as we can. And so the patient safety attendant would be the one to get the person from the room, take them to our departure lounge, give them whatever snacks, food that they might need, and assist them until someone comes to pick them up to discharge them from the hospital. Once you go up from there, you can get a CNA license or start RN school and be employed in the patient care technician. So those are our employees that assist our RNs, our nurses. So they're a vital part to our organization and provide lots of services. Montserrat is one of our people that is actually advanced to the multi-skill technician, which is that next level. But she started as a retail attendant in our nutritional area, not in one of our restaurants. So there's always a path if you want to go from non-medical to medical. We're always going to advance your pay in those types of areas, because it's so critical that we have high quality people that know our organization. So we're constantly looking to promote from within. Then you can go on to get your LPN with our tuition reimbursement, or even your RN.
Yes. On that note, I just want to say what a great need we have for people with a CNA license. So if you're kind of looking for a place to get into the medical field, that it's a wonderful place to do so. And we have a lot of openings, and we'd love to try to help you in that area if you're looking for something that might be a good fit for you there. We do have full-time, part-time, and per diem positions available in all of these areas.
And the minimum pay on a CNA position is 18. So it goes up from there based on experience. And the patient safety attendants also start at 16. So no position at Sarasota Memorial is underneath $16 an hour. So everything is from 16 up. Just a little bit more about our CNA training. We partner through a couple of different organizations, but the main one that we do is Suncoast Technical College, where our employees would be paid for their class time to attend the classes. It's 6 weeks in length. It's 4 weeks of classes and 2 weeks of clinicals here at the hospital. And, but after that, they're eligible to move it up into that next role. The great benefit to that program is that your class time is paid. So that's kind of an unheard of thing. We want people to be successful. A lot of our positions do require that you work a year before you get into a program, not all. But due to our high level of training for our employees, really it doesn't benefit that department unless you spend a year there and really understand the job before you move on to another job. I will say this has been a great starting program for a lot of people to advance themselves, perhaps to go to LPN and RN school. But I will also say that we have had a few people that through that duration of that program have decided that's not for them. And they're still employed with us. They go back to their other job, or they'll do something else within the organization. But this is just an opportunity to see, yes, if this is something that you want to do, or maybe no, it ends up not being for you, but we still want to support your growth and development. There's still going to be an opportunity for you somewhere in our organization. For pharmacy technician, it's the same kind of program. There's a ladder. There's no experience needed. You're going to go through all the training. And there's a lot of growth and development, obviously, with pharmacy right now. It's a huge opportunity. And it's also the position that's not doing direct patient care. So that is an opportunity where you're not in direct contact with the patients, but you're still supporting the patients and their healthcare and assisting them. Of course, as we have patients, we have to get them registered. We have to get our insurance billed. We have to coordinate with their health care and their benefits and make sure of their coverages. So we have several areas within the organization that do some type of patient registration, billing, insurance, authorization. Those jobs will require a high school diploma or GED. And then there are opportunities to get your certifications while you're working through those positions as well and advance throughout the organization. That's a lot of, some of the positions are going to be, facing our patients and their relatives. But then there are some that are strictly, phone types of positions where you're talking to either the insurance companies or billing, things of that nature. So both public facing positions in that patient registration area, and some that are not as well. So there's a wide variety there. but there is a lot of certificates that you can get and certification so that you can move up into a higher level in the patient registration area.
We have just a gazillion benefits for working here. I won't go through each and every one with you, but a lot of paid time off. So in your very first year, you get 23 paid days off. So it's almost 5 weeks of paid time off. It's a big difference from what you'll see at other places. We do offer that tuition reimbursement. After 90 days of employment, we'll offer you tuition reimbursement. We have medical, dental, vision. I mean, even acupuncture is covered on our plan. We have a mental health plan so that you can work with a counselor. We have flexible spending accounts, so you can get that directly taken out of your paycheck, and you can use that money that you set aside in pre-tax dollars to pay for your copayment, or like your child's braces, or something that you know you're going to need to save extra for. You can set that aside and use pre-tax dollars for that. We have a 403B retirement fund, which is very similar to a 401k. If you have a 401k currently, it rolls nicely into our 403B. We have dining here. You can pay with your badge, which I know sounds weird as a benefit, but if you forget money and you forget your lunch, you left everything at home that day, you can just swipe your badge and you can have lunch and it just comes out of your paycheck. So it's just a nice convenience factor. We have referral bonus programs. So if you come and work for us and then you refer a friend in certain positions, we'll pay you a nice bonus to do that. There's just all kinds of wonderful things about being here. If you start working for us and you have your both of your COVID vaccines, or you're fully vaccinated, or you're willing to get that within the first 5 weeks, we pay you a $500 vaccination bonus. Last year, we got 2 $500 bonuses in the middle of the year without us even knowing. And they just said, thanks for all your hard work. It's been a rough year. So they just do nice things for us all the time.
I'll also add to that, being that we are 24/7, we do recognize that some of those shifts aren't as easy to work or as desirable. So any hourly position, if it's other than first shift, it's going to pay some type of additional shift differential, what we call. And the minimum from that, it would be $1.50 an hour. And it goes up from there just based on what hours you work, what position you're in. We also pay additional shift differential for all hours on Saturday and Sunday, because we realize that that's sometimes work-life balance, that's your family life. And we do appreciate that, we still have our organization, our patients to take care of, but we recognize that, we want to compensate you for that time that, may not be that easy to give up.
So very atypical, we offer benefits to people who work part-time or full-time. As long as you're working 20 hours a week or more, you are benefit eligible. We have per diem positions. Those are not benefit eligible. And if anybody has questions about that, we can talk to you about that. But part-time and full-time positions are benefit eligible. And something else that's very different is we start those benefits the first day of the month after you start. So if you were to start working for us today on the 26th of January, you'd be benefit eligible as of February 1. So it's a very fast turnaround for you to get those benefits available to you and your family. We mentioned tuition reimbursement. We're so happy to do that for both our full-time and part-time employees. That comes after 90 days of employment. And we'll offer you, if you're a full-time employee for us, we'll offer you $3,500 each calendar year to help you offset your tuition costs. If you're a part-time employee for us, we'll offer you $1,750 each calendar year. And then that goes up if you're studying in a graduate program. All right, we have some contact information for all of you. We're hoping that everyone's going to run to their computer and apply for a position with us today. Hilda Puckett, she's not with us presenting today, but she's one of our hospitality talent sourcers. She can help with a lot of different positions here at the Sarasota main campus: housekeeping, food service, valet, transportation, transport. And her number and her email is there. Sherilyn does a wide variety of positions, pretty much anything that you would need help with here at the main campus. She would be a good source for you. And I do a wide variety of positions at the Venice campus. All of our phone numbers and email addresses are listed, and we'd love to talk with you. And I have our web address listed at the bottom. That's our direct line to our career site. When you get there, you'll see a screen that says join our team, and you can just enter in a name, a keyword of anything that you might be interested in, and that will pop up on your screen.
And you can also pick a location.
Oh, yes.
So there is a landing page for our cancer center, and then there also is for the Venice as well. So the positions, you can just view what you're interested in doing at that particular, the large campuses. And once you apply, if you don't hear from someone within a few days, definitely reach out to one of the three of us that's on that contact information sheet. But definitely someone should reach out to you after you apply and kind of see what you're interested in and how we can move you forward in the hiring process.
Mm-hmm.
And we have orientations every 2 weeks. So it's a pretty quick turnaround time from when we get your application to when we can try to get you in here.
Well, thank you for your time today, everyone. We've so appreciated your patience and with starting a few minutes late and just being a part of our webinar today. We are missing Belinda Smith. She's one of our multi-skilled technicians. Unfortunately, she had car trouble, but we have Montserrat here. If you're ready for her, we'll go ahead and put her on, Brett.
Yep, I think we're ready.
Okay, we're gonna do a little switcheroo. We had to change rooms because of our technical difficulties, so we're gonna switch.
All right.
Hi, good afternoon. My name is Montserrat. First of all, thank you for inviting me to share my experience in Sarasota Memorial Hospital. I work in the pre-op unit as an MST, multi-skilled technician. There we receive a patient scheduled for surgery, who we prepare and assist the nurses to get them ready for the surgery. They take a blood pressure, vital signs, clip and clean the areas with the surgery will be done. So I started working here in the Sarasota in May 2019 as a retail attendant in the 1700 cafe, preparing the hot meals and do some coffees for employees and visitors. They come to this hospital. In October 2020, I was promoted as a retail attendant lead in the night shift. So for a year, I work in there, and I have in charge the people in the night shift. I decided to study and continue my education. So I took a phlebotomy course, and I managed to get certificate. The biggest obstacle in there was the language. I came from Mexico, so I am a dentist in Mexico, and I'm working for 14 years in there. So this is now my the English is still hard for me, and but for comprehend. But even though the English was still new for me, I still decided to see more information to the education department program, just sending an email to the education department. So Laura Horner and Sherilyn Ballon were the ones who respond with the process and requirements I need to do, that I need to attend to the program. With their support, I was able to attend to CNA course in August of 2021. Unfortunately, after 1 week, I started the course. I lost my husband to the COVID. And again, they support me a lot. They give me the time that I needed to heal and give my family time. Okay. In October, they give me one more time. one opportunity to resume the course, and thankfully I finished successfully in Sun Coast Technical College. My instructor, Mr. Presonia, gave me all the tools and knowledge to be able to carry out my new job like as MST. In admiration and gratitude to all the health personnel and decided to join the medical team to help all these people we love who enter in a hospital without knowing if we will see them again, and especially in these difficult times. My goal is to continue preparing myself to go forward until I be an LPN or RN. Thank you so much.
Thank you, Montserrat,
We'll just,
for yeah,
Come behind
your
you there.
experience. Okay, great. Corey and Sherilyn, we have a variety of questions that we would love to ask you that have come through our Q&A box. Do you guys want to swap places again, or?
you go ahead, we may all answer based on.
Okay. Perfect. Okay, so the first question we have is, what is the starting pay for instrument assistant? How can a person make themselves an excellent candidate for this position?
So the starting pay for a sterile processing assistant is $16 an hour. That is an entry-level opportunity that doesn't require any experience. I would say if you're open to the main campus, they have more openings right now because we have a smaller surgical site in Venice. I don't think I have any openings right now in Venice. Might be different tomorrow, but at the main campus, there are several openings right now for that opportunity.
Awesome, thank you. Okay, our next question is, thank you for taking the time to share this presentation with us. I have a BS in Human Development and 7 years of experience in social work, specifically child welfare. Are there positions for social work that do not require an LCSW or master's degree? I already applied to one position, social worker position at SMH last week, and I'm keeping my fingers crossed.
So I will, if you want to email me with our contact information, I'll make sure that the recruiter that handles those positions definitely gets a hold of you. But there's a couple of different opportunities. And we should have mentioned that we also have our behavioral health facility. It is a separate building on our Sarasota main campus. But not only do we have that facility, we are starting groundbreaking on a brand new facility that will have over 100 beds for our behavioral health. So there's an opportunity at that facility, but then we also have positions at the main hospital. So a lot of times when people come in, they need to have their health, situated first, where they get their, whatever emergency situation they're in, kind of stabilized before we move them to that next step. So we have people that go into our rooms here and work with the patients directly. They also help set up, other counseling outside if that's an option, or they may go to our behavioral health facility. We also have a floor unit at the main hospital that handles some of our behavioral patients that aren't going to be staying long-term, but just to get them in a situation where they can handle whatever's going on around them until they're able to be discharged. So there are a lot of opportunities, and there again, there's a career ladder, there's advancement, but no, you don't have to have all those licenses for all the positions. Some of them do require them, but there are others that don't, and you can work in those positions if you want to then acquire the additional education, then to move forward in the organization.
Wonderful, thank you. Okay, our next question. I am not a certified CNA, but I did graduate nursing school and I have an associate degree. Would that qualify me to be a certified patient tech?
It depends on how long ago you graduated. So because we didn't really talk about it, but because we are a magnet hospital, we are one of the top 100 in the nation ranked. And to be a magnet status, under 10% of hospitals get that designation. So some of our positions do require more degrees and more certifications because we want that extra level of knowledge and service for our patients. And we're always getting that advanced technology for whatever units that we're in. So we would try to place you at your highest level of position that you're qualified for. And then once you start, if you need to get that additional education, we can help you with that. But it kind of depends on how long ago that's been. You wouldn't be able to practice as an RN, of course, unless you had your license. But there are other positions that you can work in while you're getting that license, or maybe you decided you don't want to get that license. So there's other areas that you can go into the hospital as well.
Wonderful. Okay, our next question. What advice would you have for mature workers who are considering a career change in healthcare? These are workers already accustomed to $20 hour wages and higher who may not be able to take a drastic cut in pay. So I'm assuming they mean more kind of experienced workers with more professional experience, trying to break into healthcare without maybe necessarily having to start at an entry level $16 hour position.
So sometimes, when we get into those areas, if you're doing some of those direct patient care, you may have to do a different shift to kind of get your wage up to that level, and then kind of work your way up a little bit, and then you'll be back to that level. Or you can start in like a patient registration area, which that minimum is going to be 17 and up based on, your experience. So there's a lot of positions where you can do, the food service or, registration that might be a little higher while you're working on whatever license or certification to get you back up to that wage that you really want. We try, that we pay to the highest that we possibly can, and we try to give as much credit for previous experience. So, I always say, I've done a lot of different jobs in my lifetime, but all of the things that I've done make me who I am today, and they're all relevant. So we try to give as much credit for prior work history, regardless if it's in the medical field or not, because we're still about customer service. And our patient is they are our customer, and we are customers of each other. So there's virtually nothing that you could have had experience in that we won't find beneficial for us to build on.
Wonderful. Okay, the next question, what does a typical work week look like for patient safety attendant?
So for the patient safety attendant that sits with our patients, the sitter position, you would have to do a minimum of 3 shifts a week. So that would be our per diem. That would be without benefits. So you'd make your hourly rate plus whatever shift differential that you did for the weekends, or if you did a second or third shift. They're 8-hour shifts. So it's either a 7 to 3, 3 to 11, or 11 p.m. to 7 a.m. Then the full time would be 5 shifts a week. So all of our departments, for our scheduling system, we do try to appreciate work-life balance, and we try to get those schedules out as far in advance as we can, so that people can make plans. There usually, if you're full-time, will be some type of rotation. That is something you can follow. There might be things that you have to change with, filling in for vacation or something for someone else. But usually we try to keep the schedules as stable as we can so that you can, make your plans outside of work as well. For our departure lounge, we only do the per diem. So usually it's 2 to 3 shifts a week. And those positions are usually 8 hours in duration. Once we get to the hands-on patient care, the position that Montserrat does, when we get into that CNA role or the RN or the LPN, A lot of those shifts are 12-hour shifts. So they'll be either like a 7 a.m. to 7 p.m. So you work 36 hours a week, or 7 p.m. to 7 a.m. So Montserrat, I think you're in 8-hour shifts, right?
Yeah, I didn't know what she has
So-
from Monday to Friday.
Montserrat is in one of those positions where she's doing either our pre-op or post-op, which is assisting those patients that come in and get prepared for those day surgeries. So we don't do those on the weekend. So even with her skill, she doesn't have to do weekends. She doesn't have to do a 12-hour shift. We do have a Monday through Friday 8-hour shifts as well to offer. So there's a wide variety of different schedules. And again, we try to, adhere to what we can for our employees, but keeping in mind that our patient care has to be our number one priority.
Right. Wonderful. Okay, great. We have just about 10 minutes. We're going to continue going through questions, but I want to let all the participants know if we don't get to your question, we will follow up in our recap email. We'll go ahead and list the questions we didn't get answered and provide answers for you, just in case we run out of time. But we'll keep going right now. Next question is, what is your medical insurance provider?
We have the benefit of being our own provider of our medical services. Since we are a hospital, we offer every service under the sun. We are our own provider of our services, but it works just like any other traditional insurance where you have a copay, office visit. Our benefits are really great. I always have people say, that for the price that you pay, since we're able to do that, internally and provide our own services, it's at a very competitive rate. So we do have full medical coverage, but it is provided through our own organization. Not that you can't go outside the network, but then you just get, less coverage. But there is obviously out of network available. Obviously, we have people that have college kids in other states, or people that they're covering in other areas. So obviously, we have those benefits available as well. But for the core benefits, it's within our own Sarasota Memorial system.
Wonderful. Okay, great. So another question here: is it best to email you directly with a resume or apply online?
I would suggest that you apply online first. Take a look at the website and see what things are of interest to you. And then you certainly can follow up with an email to let us know that your application's there. It's much easier for us to be looking at your resume while we're talking to you, or looking at your work history while we're talking to you. So I'd love your first step to be applying online.
Right.
And then maybe just give like 48 hours, especially if you do it over the weekends, for us to get back in and, get all those new applicants going. So you just want to fill out the whole thing. It doesn't take that long. It's pretty user-friendly system. And it's always something that you can add to, at a later time. If you find that you're only able to get through half of it, you can always log back in and complete it. You can always go back in. Our jobs change literally every day. So I think we probably have over 1,000 openings at this time. We usually run about 1,000 openings. So due to growth and people promoting. And moving, relocating here and there, just a lot of opportunities. So it is, a lot of jobs to go through, but I would recommend, if you want a particular position, like say that you're interested in something at Montserrat, if you're qualified to do that position, you might want to apply to 20 different multi-skilled tech positions, just so that, we make sure that we get your application, especially if you don't have a specific unit that you want to work in. If you're open to other units, then I would just, if you don't really know, I would just, put as many, several of those as you can. And then, what I said earlier is we typically like for you to be a year. So Montserrat could work a year in her position. And let's say that she, in her job really starts to like cardiac or some other area, then she could put in for a transfer internally after that. And through our career portal, we are able to see who is an internal candidate versus an external candidate. So we do promote from within. We do try to assist our employees first to find their homes before we bring external people in. But our orientations average, I think, about 100 to 150 new hires every 2 weeks. So we are bringing in a lot of people into our organization.
Yeah, absolutely. Great. Next question. I had a quick question regarding the pharmacy tech position. Is there a path for more education to increase your pay and role?
Yes. So there's schooling and, degrees, certifications that can move you up. And there again, we have several different facilities that we would need pharmacy located at. So it's not just at the main hospital. We have pharmacy needs at all of our facilities. So it's a very interesting, changing area. And definitely we have a lot of internal programs that can help you, as well as going to local schools to get those additional certifications in education.
Great. Next question. Patient registration says you need 2 years of experience. Does that mean someone with no experience in the field would not be considered? And what is the starting salary for patient registration?
So patient registration is going to start at 17, with really no experience. But there again, with experience, with 2 years, would we like some medical experience? We would, but certainly any type of customer service experience. So whether you've been a server, whether you've been somebody in retail, we take people from all different types of positions prior to, and then put them in that registration position. So you do not have to have medical experience. We just like to have some type of customer service, customer facing experience. Once you get into the higher levels with the benefits, we would like the benefit experience, obviously, but patient registration is a great place to start. And then you can get your additional certifications and education from there. Also, the neat thing about that position is we do have the Monday through Friday 8-hour shifts, but we also in our emergency center do the rotating 12-hour shifts. So, sometimes there's an opportunity to work 40 hours a week. Sometimes you can do the 12 hours, work in another area in the hospital and do that 12-hour rotation for 36 hours a week, which a lot of people really like, because then you get your additional days off. So, a variety of schedules for that role.
Wonderful. All right, I think we have time for one more question. And again, everyone, any of the questions we didn't get to, I will email to our presenters and have them answer, and we'll include that in our recap email for you. So with that being said, last question, does SMH have on-site childcare for employees? For lower wage workers, is there financial assistance for childcare or a discount?
We do have 2 childcare facilities. And there is a discount. According to, I don't use them myself, but several of our employees in my office that I work with have their children there. And the rate is lower than what they would have to pay, outside the organization somewhere to have their child. I would say that there's not always openings, so you might have to get on a waiting list. But I don't think that it usually takes that long. But, day one, you may not have a childcare place open for your child, but there is a process in place that you can move into, get onto that list and then get approved for that. And there's 2 different locations here that they're self-standing, but they're on the main site. And the one is actually here at the main campus. The other is a couple of miles away. And then they have, obviously very flexible hours, because they understand our staff are also doing 24 hours, 7 days a week as well.
Right. Wonderful. All right, everyone, we're just at about time. I really want to thank all of our participants for joining us today. Thank you, SMH, Corey, Sherilyn, Montserrat, so much for your time today and sharing the opportunities and your experience. As I mentioned, everyone, within 24 to 48 hours, anyone who registered will receive an email with a recording. We'll answer any unanswered questions, and we'll include the presentations we went through today as well for your reference. So thanks again, everyone. We hope you join future career connections with the Women's Resource Center. Have a great day, everyone.
Bye, thank you.
Bye.
Bye.